everyone, I'm Audrey Gibson, and today we're looking at the breakdown of science shaping clinical practice. Today's question is an important one. What role does Power Doppler ultrasound play in recognizing subclinical inflammation, specifically enthesitis? Let's start with a little background. Enthesitis refers to inflammation at the sites where tendons, ligaments, or joint capsules insert into the bone. It's a hallmark feature of spondyloarthritis and also seen in psoriatic arthritis. Clinically, we usually rely on exam findings, tenderness and swelling or pain at the insertion points. But here's the challenge. Physical exam can underestimate inflammation. Patients may have no tenderness, yet the disease process is still active beneath the surface, and that's where imaging can be helpful. Power Doppler ultrasound has emerged as a particularly powerful tool because it doesn't just show structure, it shows that activity under the surface. Standard grayscale ultrasound helps us identify chronic changes like tendon thickening, calcifications, or erosions. But with Power Doppler, we can visualize blood flow in and around the entheses, and remember, increased vascularity is a direct sign of active inflammation. So why does this matter? Detecting subclinical enthesitis before it causes symptoms or structural damage has a real clinical impact for our patients. For example, in patients with psoriasis who don't yet meet full criteria for psoriatic arthritis, Power Doppler ultrasound can uncover silent enthesitis. That helps us risk stratify patients and potentially intervene earlier. Similarly, in patients with established spondyloarthritis, subclinical Doppler signal may explain persistent fatigue or stiffness, even when routine labs and exam are normal. We do have data to back this up. Multiple studies have shown that Power Doppler signal at entheses correlates with higher disease activity scores, increased risk of progression to psoriatic arthritis, and even response to biologic therapy. In fact, Doppler findings often normalize with effective treatment, making it not only a diagnostic tool, but also a marker for monitoring response. Of course, there are some caveats. Power Doppler is operator dependent, requiring skill and experience to interpret subtle signals. Physiologic vascularity can sometimes be misread as pathology, especially in athletes. And while it's more accessible than MRI, not every clinic or routine ultrasound has that expertise. Still, I think there's a clear trend. Power Doppler ultrasound is shifting our approach to enthesitis from a reactive one, waiting until symptoms appear, to a proactive one, identifying inflammation early, even when it's subclinical. This allows for earlier diagnosis, more tailored treatment decisions, and potentially better long-term outcomes for our patients. So to sum things up, Power Doppler ultrasound plays a critical role in recognizing subclinical enthesitis by directly visualizing inflammatory activity, guiding earlier diagnosis, improving and monitoring, and ultimately helping us treat patients before irreversible damage occurs. Thanks for tuning in. I'll see you next time. If you would like more information, please check us out on the WRAP website or the WRAP ACE app.